And it's time now for our Sunday specials. Well, it has been weeks since the Lagos state government decided to investigate circumstances that led to the death of a pregnant woman in Lakowe, Ibejuleki area of the state. But there has been no resolution or white paper detailing what would be done to prevent mistakes like this from happening. And there are allegations the pregnant woman was denied emergency care at a private healthcare facility due to her inability to pay at an upfront deposit, a claim the nursing home has since denied. And this report highlights the maternal mortality crisis and the need for a health facility in a local community.
Nigeria, the most dangerous country to give birth in the world, according to the most recent UN estimates for the country, compiled from 2023 figures. Nigeria tops the list of nations with an increased number of maternal deaths. In 2023, the country accounted for 29% of global maternal deaths, with an estimated 75,000 women losing their lives to childbirth. This translates to one maternal death every 7 minutes. 3 other countries had more than 10,000 maternal deaths in 2023: India, the Democratic Republic of Congo, and Pakistan. Together, these 4 countries accounted for almost half of all maternal deaths globally in the year 2023.
Oh my goodness, Kemi, look at me.
In March 2025, a social media post from a middle-aged man, Akimbobola Folajimi, stirred conversations on the prevalence of maternal mortality in Nigeria. Although the Lagos state government is trying to drive the numbers down, it's tough when there aren't enough health clinics in local communities. Around Lakowe, Mr. Folajimi is known as Captain Blaze, a cheerful and rather outgoing person in the area. Most of the time, you will find him at his bar, hanging out with his friends, taking care of his animals behind his house, starting off a real estate business online, or simply having family time with his wife and 2 daughters who aren't shy to share their day with the world. As a couple, they had decided to focus on the 2 girls they had, but when his wife said she was expecting a baby about a year ago, Captain Blaze couldn't help but to wonder what it would be like to have a boy as a 3rd child.
Towards the time she was supposed to put to bed, she will always go out because our house is far in here. We don't have a hospital close by, so she take a bike to somewhere to go and take some check-ins, do scan, and then when she comes back, she will always tell me, oh, this is the result, this is what they tell her, this is, all I have to do is to give her funding to do whatever she wants to do. I normally don't follow her to where she's going to, but then she called me one day, she said there's a woman close by, there's a midwife. I think we should use the midwife as an alternative. And then on Friday, before I woke up, she already cleaned up the house. She was supposed to fetch water from the tap, but she did well. Just to do some exercise, according to her, she went to midwife by herself. On getting there, I realized she was already in labor. Because when she wanted to give birth to my first daughter, I was there. The second one I was there, I was always around. So I had this experience. I understand how it feels when they are in labor. I noticed she's in labor, so give thanks. I was there with her, and then the water burst. After the water, I was expecting the baby to come out, and the baby didn't come out. It was getting too late, getting longer than usual. And at this point, I was a bit scared. I was worried, and I had to ask the midwife if there's a problem, if she couldn't handle it at this point, if we should go to a nearby hospital. And the way she responded, I realized maybe it was beyond our capacity. And immediately we called on one of our good neighbors, and they came up with, they gave us a car, and we quickly rushed her to the nearby hospital. And the nearby hospital that we could think of at that particular time was that hospital that I went to. What's the name of the hospital? As-Salam Hospital.
But in February, Mr. Falajimi's world was turned upside down. He watched his wife and baby die from a possible birth complication that was left unattended to.
I asked the doctor that, what else can I do from here now? Because I didn't even know what to do. And he said, the only thing I can do now is to take her to Ekpe. Meanwhile, Ekpe from Lakwe, where we're talking about, is if not more than 40 minutes drive. And sometimes there's always traffic. So the moment the doctor mentioned Ekpe, I was a bit worried because of the distance and the condition of my wife at that particular time. I kept on begging to do whatever they need to do, that I will raise the money. But since they said no, okay, we already agreed to take her to Ekpe right from there. And we took her back to the car and we were heading to Ekpe immediately. So on our way to Ekpe, that was when I actually realized that I could actually use my phone, because I'm a content creator, you know. I was online. I was live online to call on people for prayers or for support, because it was an emergency at this point. So around the Leko, before we even get to Ekpe, around the Leko, I noticed the way she was doing, and I was really scared. She was clicking her teeth together, and then I tried to help her with oxygen, tried to pump her mouth from mouth to mouth, and I wasn't just getting it. Everything just happened just like that.
At the As-Salam Hospital, which is about 15 minutes away from Mr. Falajimi's house, the proprietor of the hospital had a different narrative. But Mr. Falajimi feels the hospital's demand for payment contributed to his wife's death.
So by the time when she was assessed, it was discovered that she was paper white. There was no blood in the system. To that, even during the course that the husband was just saying, oh, please help me, I will do this, I will do that, I will pay you this. And having assessed, they found that the woman was pale. She needed urgent blood transfusion. Look at this place. It's a convalescent center. We don't handle such kind of cases. So he was advised to take him down to take her down to the general hospital, because most facilities don't have blood. And within 5 minutes thereabout, they left here. We did not hear anything again. I think my colleague said when he was going, one of the people who followed her was asking her, as we are going to general hospital, how much do we hold her hand? And he suggested, if you can take like 500,000.
Together, they made this one room a home filled with love for themselves and their 2 daughters. Now, Mr. Falajimi is working to ensure the children remember their mother's legacy. He wants his wife to be remembered for her hard work and dedication to the family.
It's tough. Those kids will wake up in the middle of the night and shout, "Mommy, mommy, mommy." This one will say, "You get dream." This one will say, "You say you dreamt about your mommy." And where are too? It's happening like steady. This one will cough, you know. I have to wake up in the middle of the night to mop their body, to give them medication.
Aside the bottled up grief in his heart, is trying to survive the online trolling he's experienced since he posted a video of himself desperately trying to get help from a hospital for his wife. Behind every statistic is a face, a family, a future cut short. Akimbobola Falajimi's voice may be just one, but it carries the weight of many seeking affordable and accessible health care. Sarah Ayeku, TVC News, Lagos.